Did you know that there are various plants that are used for the medicinal purposes? Since the beginning of civilization, plant resources have been utilized for the well-being of mankind. From the 250,000 higher plant species on Earth, more than 80,000 are medicinal plants. According to the World Health Organization, about 80% of the world's population rely on the traditional medicine for the primary healthcare needs. Studies have proved that the medicinal value of the plants are because of the presence of certain classes of chemical constituents that bring a specific physiological effect on the human body. Most of these biochemicals are secondary metabolites known as the phytochemicals. These bioactive compounds found in plants work with nutrients and dietary fibers to protect humans against diseases. Many phytochemicals have antioxidant activity and reduce the risk of many diseases. The medicinal value of the plant lies in bioactive phytochemical constituents that produce definite physiological action on the human body. Some of these phytochemicals include saponins, alkaloids, flavonoids, tannins, phenolic compounds. A large number of these chemical constituents act together in complex ways to produce the therapeutic effect of the medicine. Due to this, the natural compounds in these medicinal plants are studied in the pharmaceutical industries to identify the therapeutic agents present in them. Dioscorea bulbifera, commonly known as air potato. The bulbs and tubers of this plant were first washed with tap water, shade-dried at the room temperature and then were powdered using an electrical blender for the analysis of phytoconstituents, heavy metals, and inorganic elements. This phytochemical screening revealed the presence of alkaloids, carbohydrates, glycosides, phytosterols, saponins, tannins, phenols, flavonoids, proteins, amino acids, and terpenoids. The presence of nutritionally important elements such as calcium, sodium, potassium, magnesium, iron, and zinc were observed in the selected parts of the plant. The results obtained show that the levels of three potentially toxic heavy metals, arsenic, lead, mercury, were analyzed in this study were quite below the permissible limits in both the plant parts. Malva sylvestris, commonly known as common mallow, used as food and medicine in Europe since the time of ancient Greece and Rome. It is traditionally used for the treatment of injuries, inflammation, burn healing, swelling, and as well as anti-inflammatory agent for the respiratory and gastrointestinal tracts, skin disorders, coughs, and mouth irritations. Mallow leaves and flowers feature high amount of lime and carbohydrates. Mallow is typically applied as a tea or gargle for these indications. Sylvestris has also been used in cancer and alka healing because it is reported to contain flavonoids, tannin, phenolic compounds, ascorbic acid, carotenoids, and tocopherols. It has been claimed that the levels of this plant have powerful anti-inflammatory, antioxidant, and skin tissue integrator properties. Woodfordia fructicosa grows root. Woodfordia fruticosa is a large shrub growing up to 5 meters tall with long, spreading branches which belongs to the family Latraceae. Bark of the shrub is smooth and reddish-brown in color with very thin and small fibrous stripes. The leaves are about 5 to 9 centimeters long, oblong or ovate or lanceolate. The shrub bears numerous flowers that are bright red in color. Woodfordia fruticosa was used traditionally in the rural areas from the long back for different purposes. Its medicinal value is even well known today. The flowers of fruticosa contain phenolic compounds, tannins, especially hydrolyzable tannins, and flavonoids. Leaves of this plant contain triterpenoids, lupeol. Other constituents present in leaves are betulin, betulinic acid, oleonic acid, uracilic acid, Gallic acid is also present in leaves and stems. The dried flowers of this plant are reported to be used for the treatment of hemorrhoids, dysentery, diarrhea, liver diseases, piles, mucous membranes related disorder, leukorrhea, menorrhea, alka, wounds, burning sensation, skin diseases, fever, and herpes. Since these medicinal plants have potential use in the field of food preparation and pharmaceuticals, it is advisable to ensure that they are collected from an unpolluted natural habitat. Therefore, this work findings may help all researchers, pharmacological investigators, dosage form formulators, and pharmaceutical scientists to develop new therapeutic techniques in field of health science.